We're now going to demonstrate a screening low back exam. We're going to be doing this in the sitting, standing, supine, and prone positions, as this is the most comfortable way for the patient to have the exam completed. In this phase of the exam, we're going to do the exam components that we like to do with the patient standing. We're going to have him first take a couple of steps. We're going to examine his gait, looking for any foot drop, any listing of the patient to one side or the other, or if they have an antalgic gait or a limp as they gait. Now we'll check heel and toe walking, so have the patient come up on the toes. And you want them to take several steps, as you want to fatigue the muscles if there's any subtle weakness. Now have them go back and heel walk. Good. The next thing I check is range of motion. I'm going to have the patient turn with his back here, and what I'm going to examine is the number of degrees with forward, flexion, extension, and side bending. So let's have you go ahead and bend forward. And I always caution the patient to only go as far as they can comfortably. Okay, come back up. Now bend to the back. Great. Come back to neutral position. Bend to the right side, left side. Excellent. Next thing we'll do in this position is check for scoliosis. To do this, have the patient bend forward to a comfortable position, and you want to examine, make sure that there's no rib hump on either side, and then inspect the spine to see if there's any obvious curvature. Stand up. We're now going to demonstrate the components of the exam that we do in the sitting position. Start first with our deep tendon reflexes. The knee, which is the L4 nerve root, and the Achilles, which is the S1 nerve root. There is no reflex that we commonly check for the L5 nerve root. Next, we'll do the sensory exam, and I like to do that with dermatomes on the foot, as it's easy to do when the patient's wearing pants, as this patient is here. So we start first on the lateral aspect of the foot, comparing one side to the other. That's the S1 nerve root. Then we move to the L5 nerve root, which is the web space between the big toe and the second toe. Again, comparing one side to the other. Then you can check the L4 nerve root by examining the medial aspect of the foot. We can also do components of the strength exam with a patient in the sitting position. To do this, we can check the L4 nerve root by having the patient contract their quadriceps, so they're pushing out against my hand. So go ahead and push out against my hand. It's a large muscle, and you should not be able to overcome it in a normal patient without any weakness. We can also check for the L5 nerve root by checking the extensor hallucis longus. To do this, you have the person bring their big toe up. Okay, don't let me push down. Good. Again, very important to compare one side to the other. Another way to check the L5 nerve root is by having the patient bring their whole foot up. So they're going to dorsiflex the foot, and then you push down. And again, you should not be able to overcome that strong muscle group. And then we can check the S1 nerve root by having the patient plantar flex. So push down against my hand. Good. Push down again. Again, important to compare one side to the other. Finally, you can do a straight leg raising test with the patient in the sitting position. Raising the leg up, and a positive test would be any tingling or numbness or pain in a radicular pattern, either in the lower leg or in the foot. Next, we'll demonstrate the components that we do with the patient in the supine position. It's always important to check range of motion of the hip. A simple way to do that is to bring the leg up, and you can check external rotation and internal rotation, looking for any limitation. You can then put the patient in so-called figure of four or Fabre's test, where you bring the knee down in this position, and if there's any sacroiliac joint discomfort as you do this, then you worry about a possible sacroiliitis or other inflammation in that area. Next, you can check for any piriformis tenderness by bringing the knee across the chest towards the opposite shoulder. And if they have pain in the buttock region, one side compared to the other, then that would be an indication that there may be some piriformis irritation. It's also important to check for hamstring flexibility. And to do this, you just bring the leg up straight. And you should get close to 90 degrees. If not, then there is some hamstring tightness that will need to be addressed in a rehab program. You're also doing straight leg raising test when you do this. And so the patient complains of any tingling or focal neurologic symptoms in the foot or lower leg. That is a positive straight leg raising test. If they complain of just low back discomfort, then that's a negative test. And again, you can compare your findings in this position to those that you had in the sitting position. You can also accentuate this by pulling the foot down as you do the straight leg raising test. You can also check for possible abdominal aortic aneurysm by palpating for pulsatile mass. And then check for peripheral pulses as well, checking the dorsalis pedis and the posterior tibial on both sides, comparing to see if there's any difference. Next, we'll demonstrate the components of the exam with the patient in the prone position. This is where we do most of the palpation. And initially, I like to palpate the vertebral bodies individually as best that you can do that, wiggling them to check to see if there's any focal tenderness that might indicate tumor or infection. Next, I'll palpate the paraspinal musculature, looking for any spasm, muscle tightness, or focal tenderness. Then I'll check the sacroiliac joint, looking for any tenderness as I press down one side and then the other. Then you can check for focal tenderness in the piriformis by pressing down in the buttock region. I also like to do what's called a spring test, where you just gently press down on the lumbar spine to see how much flexibility they have in general. If this is very tight and inflexible, that would be more suggestive of degenerative changes.